as well. We have Dr. Schooler saying, I shared the link for this live stream everywhere. I think that's a common sentiment among our listeners here, given our wonderful guest returning to the show today. So I'm going to introduce him in just a moment. But for those who haven't been with us, I'm sure we have a lot of new listeners today who want to hear our guest. This is an offering of the Gaeta Institute for Holistic Health Education. And our motto here, as is with the Gaeta Clinic for Chinese and Functional Medicine, is nature first, drugs last. And that just means nothing wrong with pharma drugs at all. They're wonderful and necessary at times. And they're simply overused, at least in the US, and there's a natural solution most of the time. And so that gets us to our show today. This is show number 304 for this February 23rd. And we are just delighted, just very honored to have back to the show the wonderful Dr. Peter McCullough, one of my favorite physicians. We're going to be talking today in today's show about the McCullough protocol for base spike detoxification. I'm sure there's nobody listening who doesn't know Dr. McCullough. He is so appreciated by so many who are of our listeners here. He is a cardiologist, internist, and epidemiologist. He is the co-author of The Courage to Face COVID-19. He is the founder of the McCullough Foundation and the medical director for the Wellness Company. Our topic today is going to be the McCullough Protocol for Base Spike Detoxification. And you can find him at petermcculloughmd.com and also petermcculloughmd.substack.com, where he publishes extensively on topics related to the COVID injections, medical freedom, and a range of other topics. So please, and also if you haven't yet, please go to his show site. It's Focal Points, Courageous Discourse, and I just had the honor to recently appear for the fourth time on Dr. McCullough's podcast. We had a wonderful conversation focusing on cancer, and I thought that was a very productive conversation. Dr. McCullough is not just a cardiologist, he's also an internist who sees patients with a range of issues. So with that, and here is, I had the great honor of welcoming Dr. McCullough to my cardiovascular seminar in 2024 in Dallas, where he is located and practices. And as I shared with a couple of you, it was a little nerve-wracking doing a presentation presenting some basic concepts of cardiology with one of the greatest cardiologists ever sitting in the back of the room. But I managed to get through it, and we had a wonderful conversation, and he shared a lot of insights with us at that event. And as always, if you're on our watch page or on our Zoom chat, we really welcome your questions. Dr. McCullough is just someone we're very honored to have with us. So let's give a warm Mondays with Michael welcome to Dr. Peter McCullough. You can type on whatever platform you're on, and just give Dr. McCullough a warm welcome. Peter, so good to see you.
Well, great to see you, and thanks to each and every one of you for joining. Dr. Gaeta, I think, is held, at least in my view, as one of the greatest naturopathic medicine doctors that we have in the United States today. And I've had patients visit him at his institute in Boulder and so satisfied with his solutions. He mentioned this mantra of kind of natural first and drugs last. I think there's no better problem than the spike protein to apply those principles. Because I can tell you, I'm a drug prescribing doctor. And over the last 6 years, I have tried every drug in the world against this spike protein, the SARS-CoV-2 spike protein, without success, Michael.
Wow.
And in fact, the successes have really come through natural products, which is, in many ways, it's an interesting observation. Yeah. The spike protein, which is the spine on the surface of the virus, this is what I'm talking about here. It's the little spicule on the surface of the SARS-CoV-2 virus. It's the synthetic, artificial part of the virus. Right. It's not a naturally occurring protein. It's a
Hmm.
protein that was harvested off a bat coronavirus. It is about 1,200 amino acids in length. It has about a dozen glycosylated side chains, about
Hmm.
3,400 base pairs code for it. But it's been specifically engineered in the Wuhan Institute of Virology to dock with human ACE2 or angiotensin converting enzyme 2 receptors,
Hmm.
to invade the human respiratory epithelial cells, and then actually invade the body.
Right.
I think what many didn't expect is that this protein would not be amenable to typical human proteases. The
Hmm.
human body has many natural enzymes to just break down proteins. We get influenza, we have
Yep.
a variety of neuraminidase and hemagglutinates. It breaks it down. We get other things in our body. You get staphylococcal toxin, and we break it down. But the spike protein we cannot break down with our own apparatus.
Hmm.
And so through the early efforts of the Biden administration, the long COVID research program, which was $1 billion spent,
Hmm.
the approach was to try to get the body to, in a sense, if we could just manage inflammation from the spike protein, things would get better. Or if
Hmm.
we could just manage symptoms from neuropathic symptoms, things would get better. The problem with the Biden administration program is not a single project addressed the spike protein. Not a
Oh.
single research project measured the spike protein.
Hmm.
And now we're all coming to realize that the spike protein is the cause of long COVID syndrome. It is
Yeah.
the cause of the vaccine injury syndromes. It is found in the human heart, in the brain. It's at the site of blood vessel ruptures and stroke. It's in blood clots, causing the blood clotting. And patients are getting enormously frustrated because they're seeing doctors. They know the spike protein is the cause of the problem, and the doctors are baffled. And a typical doctor like me, an allopathic doctor, would try drugs first. And of course, I've
Right.
done that as well. And it doesn't solve the problem. Even blood thinners for blood clots don't, in many cases, solve the problem. The spike protein is still causing this persistent rubberized blood clot, this amyloid type of fibril dense blood clot. And so we
Right.
need natural products to dissolve it. So if you can bring up the guide,
Yeah, happy
and
to.
right now I can only see you in a limited screen. I have really backed myself into some
Oh,
type
no
of
problem at all.
problem in
No
Zoom.
problem at all.
I'm in my media room in my office. So my clinical exam room is right across the
Sure.
hall here. I don't have Nick Hulscher here, my trusty assistant. He would help me get out of
He's
this.
doing a great job, by the way. I mean, it's just amazing what he's putting out, and like you, he's really getting the word out broadly and about the dangers of these injections. So I
Well,
just appreciate the work two of you are doing.
he gives us great hope for Nick's not even 30 years old yet. So
I know.
Nick gives us great hope for the next generation. Okay, so do you have the spike protein
I
guide up?
do. I
Okay,
do.
boy, I sure wish I could see it. But what we did at the Wellness Company, and as Dr. Gaeta pointed out, I am the Chief Scientific Officer of the Wellness Company and one of the founders of the company since 2022,
Yes.
that we've created a guide, a layperson's guide to describe the spike protein. I believe the guide's about 6 pages in length, and you can hand it out to patients. It's scientifically referenced, everything in there. We have the backing for, so people can understand that the spike protein retained in the human body
Mm.
is fundamentally the cause of these pandemic syndromes. And if you get to, I believe, about page 4 on the guide, if you can bring it
Yeah.
up.
Are you able to see the viewer screen?
I can't see it.
Oh, okay. No
Right
problem.
now, I'm so limited in what I can see.
Oh, no problem at all. I
Um,
got you covered.
Yeah, and so if you can,
And Peter, I just wanted to back up just for a sec.
yeah.
Could you just explain a bit? Because I know so much of what you've published in your career has been around the renal system and the kidneys. Could you just explain for our listeners who are not as aware the significance of the ACE2 receptor for this entity?
Well, sure. ACE2 receptors. Now I can see the guide. I kept clicking buttons, and I got there.
Okay.
The spike protein, it folds, and it does lock into the ACE2 receptor. The ACE2 receptor is on virtually every cell in the human body. It's on immune cells,
Right.
and it is a receptor that is worked to essentially catabolize angiotensin converting enzyme. And what the ingenuity was in the Wuhan Institute of Virology is to harness this receptor as an entry point for the spike protein. So the spike protein comes in contact with the receptor,
Right.
and the little outer part is able
Yes.
to get in. The inner part folds, the S2 part, and that's sacrificed. That actually is catabolized by the ACE2 receptor. And then the virus just, boom, goes right into the human cell. So it's ACE2 receptors, because they're so catabolically active,
Right.
it turns out that people with more numerous receptors did better than those with fewer receptors because they
Really?
could chew up the SARS-CoV. So the case in point is children. Children's lungs are loaded with ACE2 receptors, so they cleared out the spike protein easily. They didn't get COVID pneumonia. So when you get older, you have fewer ACE2 receptors, and so there's less catabolism. And so and there's always enough receptors for the virus to invade and cause problems. But they're all in the human body, all around the human body. They are an important entry point.
Yeah.
But when you get the virus, and 90% of us have gotten the virus, we have the little tip. The S2 gets stuck in our human body. It's been found in what's called exosomes, or little phospholipid packets, or within white blood cells in the human body for years after the infection. Years. Now, when you take a vaccine, Pfizer, Moderna, it's the genetic code for the full-length spike protein, the full-length spike protein.
Right.
And that genetic code comes into the body. It bypasses any ACE2 receptor, obviously, and it just starts producing spike protein. The spike protein is held open in the pre-fusion conformation. So the vaccine spike protein does not fuse with the ACE2 receptor. There's no catabolism there. And so it quickly trimerizes. It folds into little bundles of 3, and that held open full-length spike protein begins to circulate in the human body and deposit in tissues and cause damage.
Right.
This is very important. So all these papers you read about the vaccine and the ACE2 receptor are irrelevant. That's just people not conceiving what's going on. We've, in patients now, measured the spike protein, the full vaccine spike protein in the human body 3.6 years after taking the shots in the bloodstream.
So does it seem that this is going to be sort of permanent, folks who have received the injection who don't take other measures?
We don't know.
That's a long time.
But I can tell you it's a long time, and I think it's evidence that the human body alone can't break it down. Now, fortunately, in this individual, once we started the natural enzymes to start breaking it down, sure enough, he cleared that spike protein out of the bloodstream, which is...
And are there methods reliably of measuring either the protein or the antibodies or the bioburden or anything related to it? Do we have any good metric?
Right now, we have antibodies directed against the spike protein as an indirect measure.
Okay.
And then very shortly, we should be able to directly measure spike protein. So, matter of fact, our office has a call today regarding, finally getting that up and running, which will be huge. And I think it's going to be very alarming for people to see that they took a vaccine and the spike protein is still in their body years later.
Wow.
But bring back up, now I can see things, Michael. Bring up the...
Happy to. And your foundation has published extensively on damage from the injections and from the spike protein. Cancer, cardiovascular disease, I mean, it's a pretty enormous list. So just for our clarity for our listeners, all of this catastrophe that we're seeing, cancer, all-cause mortality, the long list, is due to the persistent spike protein.
Yeah, there's could be some of this that's directly due to the messenger RNA of Pfizer and Moderna alone, but most of it, Michael, we think is due to the spike protein.
Wow.
And
Wow.
virtually everything we're seeing with the vaccine,
Yep.
you can actually get with the infection. It's just that there's a lower risk
Huh.
because, again, it's the spike protein.
Right. Right.
So, for instance, one syndrome that I think is pretty similar in risk is blood clots. I
Hmm.
see blood clots every day in patients. I had 2 or 3
Wow.
today.
Mm.
And I think the risk is the same if you've had the infection or the vaccine or both.
Wow. Wow.
Now, myocarditis is much greater with the vaccine because it's just a
Yes.
much greater loading of the spike protein. And yet the American College of Cardiology has just the opposite idea, that there's
Huh.
more of a risk with the infection than the vaccine. And well,
Mm.
90% of us have had the vaccine,
Right.
and it's only the serious and fatal cases of myocarditis that occur with the vaccine as opposed to the infection. So just to clarify,
Yeah.
90% of us have had the infection,
Right.
and 81% of us have had at least 1 dose of the vaccine.
Mm.
70% of us have had 2 doses of the vaccine.
Yes. Yes.
Okay, so we're back on the guide, and it has 5 chapters and conclusions. And if you can go just to the next page of the guide.
Sure.
And we put this together and curated it to describe the spike protein and tell you the tissues where it's found, including the lungs, the heart, the kidneys, the gastrointestinal tract, the lining of blood vessels. We think that's very important. I mean, this is all in the peer-reviewed literature. Why certain people are affected more than others? Well, older, overall health status that's poor, other environmental exposures. This is important. We seem to find patients who've been exposed to mold toxins, tick-borne diseases, heavy metals. They seem to be actually more affected by the spike protein. And I think a lot of the practitioners listening will say, gosh, I have patients who seem to have multiple of these, in a sense, kind of environmental exposure related illnesses.
And Peter, what's your take on this shedding idea?
You know, Helene Benoon at INSERM in France, or formerly at INSERM, has published the most on this. I think shedding has been reliably described in menstruating women when one woman comes in contact, let's say a vaccinated woman comes in contact with an unvaccinated woman, changing the periodicity of the menstrual cycle. That's been demonstrated. There's not a single case, a confirmed case of transference of messenger RNA. That has not been shown.
Okay.
I think the shedding that occurs, based on what's been published, can certainly make somebody feel uncomfortable or ill around somebody else who's shedding spike protein. The spike protein, by the way, does come out in these exosomes in exhaled breath, sweat, and other human secretions.
Yep.
But I don't think it causes bona fide illness. I haven't seen this kind of transfer.
Okay.
Yeah, you see what I mean? So people can feel transiently ill.
Yep.
That's the extent. Now, I got a question today about blood transfusion.
Yes.
Remember, blood only stays on the shelf 42 days.
Right.
So, back when everyone was taking the vaccine in 2021, myself and Dr. Cole and others wrote the American College of Blood Banking. We were concerned about this, and they responded back months later, indicating they don't have a concern. But, here we are today. In reality, probably fewer than 1% of people taking a COVID vaccine, and fewer than them actually donating blood.
Right.
So, I really don't think we have concerns right now. And I know many. Remember, blood transfusions are not lightly administered. So if someone really needs a blood transfusion, I think that the benefits would outweigh the risks.
Okay. It's for surgery or trauma.
Yeah. There's never been a bona fide case of transference. Okay. So if you can look at this spike protein distribution in body systems in that lower right, and we'll challenge you in terms of your ability to expand that.
Oh, no problem.
Compartmental diagram.
Yep.
You can see this concept here that it has been shown the spike protein is everywhere in the body. 320 peer-reviewed studies now demonstrating that it's in blood vessels, the lungs, kidneys, brain, heart in the peripheral tissues. And very importantly, it is related to what's called microclotting. The spike protein links up other red blood cells in a formation we see under the microscope called rouleau formation.
Yes.
And multiple studies show micro blood clots traveling in the blood vessels behind the retina, for instance. They almost certainly are the nidus for stroke.
Yep.
And in an important study where patients who had post-exertional muscle fatigue, they underwent calf biopsies, and they found, again, this spike protein rouleau formation in the capillaries of blood vessels. So this brings up this idea of, getting rid of the spike protein in the human body, but also encouraging exercise and blood flow. My most severe long COVID and vaccine injury syndrome patients are completely sedentary. And I think exercise, particularly in these syndromes, is therapeutic just because it's augmenting blood flow through these capillaries.
So, Peter, is it that the endothelial cells are expressing spike, or are they getting damaged by circulating spike?
Both.
Oh, okay.
Both. In the vaccinated, don't forget, the messenger RNA is also equally long-lasting. In this case report we just published, Pfizer was circulating in the bloodstream 3.6 years later. The synthetic messenger RNA of Pfizer. It must be passed from cell to cell to cell. Okay, let's move on to the next page.
Sure.
And make it smaller again. So this kind of shows a total body distribution of where we have evidence. And some people may ask, well, why does one person have a neuropathy, another person have myocarditis, another person have, and it probably actually has to do with the predominant distribution. Blood distribution in the body is not equal, and each person, it's different. They may have taken the shot and gone exercising. Some may have gone swimming. Some have felt sick and just go home and lay down. Each person's different. Marc Giaudot from France has been publishing on this idea of what's called the bolus theory. That is, the vaccine centers were told to just plunge the needle in the deltoid muscle, inject, and not to aspirate back. And in these vaccine centers in 2021, many were not medical personnel. And I can tell you, as a doctor giving injections, I always aspirate back to make sure I'm not in a venule or a capillary.
And could you just explain that a little more for folks who are not practitioners, Peter, just what that means?
There are blood vessels in the muscle where the vaccine was given. And if the needle happened to go right into a blood vessel, then that meant when the plunger goes down, Pfizer, Moderna, or Janssen, or Novavax would have been immediately distributed through the circulation. If it hit muscle without any appreciable entry into a larger blood vessel, it just would have stayed in the muscle longer. And so if it stays in the muscle longer, it may get a milder, more even distribution in the human body.
Interesting. Okay.
But if it hit a venule and it was, let's say, half a cc that got mainstream, then it's just a matter of where did it circulate in that first pass through the human body. So I had one patient who traveled to see me from Washington State, a wonderful man who took the vaccine because he worked as a defense contractor. And as he took the vaccine, he said he basically could feel warmth going up his neck into his head, like immediately in the first minute after the shot.
Wow.
And I think it went into a venule. And sure enough, about a year or so later, he had a brutal headache and had a rupture of the blood vessel in his brain, blood into his brain, needed neurosurgery. He has a shunt put in. His skull has been opened and closed again.
Wow.
And a paper by Ota and colleagues, they found spike protein right in the blood vessels that have burst in the brain, causing intracranial hemorrhage.
Oh, wow.
It's as plain as that. The spike protein, when it lodges in the blood vessels, Michael, it attracts inflammation. And then over time, that inflammation can be sufficiently destructive to cause the blood vessel to rupture. Just like if there's enough spike protein in the heart, there can
Yes.
be enough inflammation to cause chest pain or
Yeah.
cause a cardiac arrhythmia. If there's a ton of inflammation and the right trigger of adrenaline and noradrenaline and dopamine, like so let's say during exercise, it can
Right.
trigger a cardiac arrest.
Hmm. Hmm.
So I think there's this variability in blood distribution. I think Mark Giordano is onto something.
Yep.
The other thing is in
So,
each person, yeah,
so Peter, would you say for folks who are concerned that anything that improves circulation would be beneficial?
yes,
Okay. All right. Because we
yes.
have a range of options
Hmm.
in the natural field as well to things that optimize or increase circulation from foods to herbs to PEMF devices that are designed to, or we know, improve microvascular circulation. So that's very helpful.
Yes. Now, I want you to turn your attention to the spike distribution diagram over here for a therapeutic point, and
Yeah.
that is look at the bottom on the right where it says skin and
Yep.
sweat glands.
Yep.
So in the patient we've recently published who's, has Pfizer Moderna circulating in his blood for 3.5 years,
Yes.
we found it in his skin. We did 2 sets of skin biopsies.
Oh.
And so spike protein and messenger RNA come out in sweat.
Oh, so that's measurable on biopsy?
Yes.
Really?
Yes. It's
Oh.
a technique called reverse qPCR done in skin tissue. Then, of course, standard enzyme-linked immunostaining for the spike. But listen to this.
Interesting.
If spike and messenger RNA come out in sweat,
Right?
and sweating is a minor detoxifiant
Right.
system for the body, liver and kidneys being the big ones.
Yep.
But
Yep.
still, if it comes out in sweat, we
Right.
need to take advantage of this. So, I'm encouraging all my patients suffering with this is to get outside and sweat. Many get
Oh,
infrared saunas
okay.
at home. These little teepees are very
Yep.
affordable.
Yep.
They go inside and they sweat. There's all different types of devices, Beamer and others, that
Yep.
get people sweating. This is very, very important. If
Yes.
people can sweat, they are going to reliably get spike protein and messenger RNA out of the body. So I would say this, my worst cases are patients that say, Dr. McCullough, I cannot go outside and face the heat. I cannot sweat.
Oh. Huh.
I cannot sweat. Oh, yes. And it seems like the more
Huh.
spike protein they have in their body, they feel so uncomfortable getting hot and sweating.
Oh,
And so it's a
okay.
vicious cycle.
Interesting.
I tell people, listen, you have to start sweating. You've got to
Yeah.
get in a sauna, go outside and sweat. And, after the initial wave of cardiac arrests that we saw in the athletes,
Right.
particularly in Europe, the
Yeah.
athletes seemed to be fine. And
Really?
you know why? I think because they sweated this out. They detoxified themselves. Yeah.
Wow.
Yeah.
Very interesting.
Yeah.
Huh.
So I think sweat is super important.
Okay.
Super important.
That's
And
great.
since we've now been able to identify this in the skin, it does go to all the other organs.
Yes.
And it explains why people say, well, gosh, could my new onset Hashimoto's thyroiditis be related to the vaccine? Well, yes,
Right.
it's been found there. How about new onset type 1 diabetes? Yes,
Right.
because it's been found in the pancreas. I mean, all of these syndromes have been described.
So, Peter, Sherry Tenpenny has been talking about mechanisms of vaccine injury for a while. One of them, wanted to get your take on this, was basically cross-reactivity through molecular mimicry. She identified some time ago, or at least located somehow, there are 28 body cell types that were antigenically or epitopically similar enough to the spike protein that spike antibodies would cross-react and target healthy body cells. What's your take on that?
Well, there's a paper from Florida Atlantic University, and I think the first author is Agramonte, I believe. But yeah, it's close 28. I think I remember 32 homology with 32 different human proteins
Wow.
contained in the spike protein.
Oh,
So that's the reason why
wow.
there's so much closeness there. The spike protein was being manipulated in a Chinese lab. So of course they were they kept trying to mimic human proteins to get it
Right.
to, in a sense, be humanized enough to
Right.
be accepted, right?
That would make
And
autoimmune conditions pretty likely.
Oh, for sure. So in each and every patient, I check the blood ANA,
Right.
rheumatoid factor, and anti-citrulated peptide. Today, I
Yep.
had a patient who turned ANA positive just from the infection, not the
Really?
vaccine. Yeah, so if it
Oh,
was the infection of the vaccine, we're seeing autoimmunity. So the syndromes that have been described after infection or the vaccine include a mixed connective tissue disease. So
right.
not straight up lupus, but mixed
Yep.
connective tissue disease. Another one is rheumatoid arthritis of different, typically not with rheumatoid nodules, but just the arthritic component to it.
Hmm.
Another one is gluten sensitivity, for
Hmm.
sure.
Hmm.
Another one is just today on Twitter, someone posted it and it's been shown before, myasthenia gravis.
Oh, sure.
Yeah. So one of the features here is that if you don't get rid of the spike protein, you still have all this stimulus for autoimmunity.
Yes.
So in the autoimmune
Yes.
syndromes, my practice pattern is spike detoxification
Hmm.
with nattokinase, bromelain, curcumin, and other natural,
Yes.
enzymes and herbs, but also using hydroxychloroquine to shut off that
Oh.
autoimmune process.
Huh. Okay.
And so I had to do that today. She goes, listen, I did the detox doc for 6 months. I'm still
Right.
not better. And
Huh.
she's resistant to taking hydroxychloroquine. I said, listen, hydroxychloroquine is a natural product. It's derived from the bark of the cinchona tree.
Yep.
We're just going to need to take it for, I think, 3 months to shut off the autoimmunity, maybe 6. I haven't had
Interesting.
anybody need it long term. Remember, hydroxychloroquine has got concerns regarding ocular toxicity at about 5 years.
Hmm.
5 years. Okay.
Hmm.
So,
Oh, continuous use for 5 years.
yeah.
Oh,
Yeah. She
okay.
was told by her doctor, don't take it. You could have eye problems, after a
Mm.
few days. It's like, no,
A
it's
few
5 years.
days.
Yeah.
Oh, wow.
Okay. So
Okay.
let's go on. So the spike protein, let's go to the next page, is the,
Sure.
and so this is important. The bottom left is
Yep.
our work on this,
Yeah.
where we think most of the risk of cardiac arrest occurred early on when the
Huh.
spike protein was in the heart. Believe it or not, antibodies that were not binding the spike protein
Right.
it could have been a problem. There was a paper by Yonker and colleagues showing
Yes.
that it was published in Circulation, our best cardiology journal. So these poor young boys suffering with myocarditis in Massachusetts General Hospital,
Yes.
they had very high antibodies to the spike protein, but it wasn't binding the spike protein. They were
Huh.
misdirected antibodies, so the spike was allowed to damage the heart.
Oh.
And so the spike protein are like those little dart-like structures in the upper left.
Right.
But what we and others have demonstrated is that probably almost everybody has some heart inflammation after the vaccine. They may even have some actually after the infection.
Wow.
But it's
So,
the
Is that an
surge.
autoimmune mechanism?
No,
Uh,
it's a direct toxicity mechanism.
Oh,
Direct
wow. Okay.
toxicity. There's not
Okay.
much autoimmunity here.
Hmm.
But with a surge of adrenaline and inflamed tissue, that's what that little inset shows. It shows
Yes.
these little purple dots. That's inflammation around the cardiomyocytes. And the surge of adrenaline, that's what triggers these cardiac arrests. That's the reason why the majority have occurred on the athletic field,
Yeah.
or they occur between 3 a.m. and 6 a.m. during the normal waking hours of sleep when there's a big surge, a natural surge of adrenaline.
Hmm.
So it's either found out dead on the athletic field or jogging, or found dead in bed. And that's been the pattern of young people dying after the vaccine.
Wow.
So, let me just show you. In the bottom,
Please.
the initial rhythm you can see there is ventricular tachycardia. I had a patient last week who took the vaccine. He took 2 Moderna shots and had played baseball, and the kids were responsible for mowing the field afterwards. And so
Oh.
he was weed eating on a baseball field, and he had a cardiac arrest. And
Oh.
it took forever for the boys to get back there and call 911 and all this. And he was kind of intermittently gagging and choking. So he's in and out of consciousness. And that told me he was probably in ventricular tachycardia, not ventricular fibrillation, which is a flat line. Paramedics got there, and it was just late, like half an hour into this whole thing, or 45 minutes. And one shock brought the boy back. So that told me it was ventricular tachycardia. It was a convertible rhythm. And so he was shocked. And the sad part of this is that the doctors never recognized it was a vaccine or spike protein. He's loaded with it. I've checked him. And his defibrillator, he got a subcutaneous ICD. It migrated in his chest. He had to have a repeat surgery, had
Hmm.
a pocket formed, fashioned out of it, out of a bovine pericardium. Then
Oh.
that got infected, and then the whole system had to be taken out. So here's this young boy
Oh.
who's 21. He just wanted to
Oh.
play baseball in Louisiana, and his chest looks like there's been a battle axe taken to his
Oh.
left thorax, and his parents are crying, and they're saying, Dr. McCullough, this vaccine was so horrible. He didn't need it anyway.
Right.
And it's true. Young people, even if a vaccine was safe and effective, they didn't need it. Young people didn't.
Right.
So many people's lives have been ruined by this process. Okay, let's
It has.
zoom out
Yep.
and get to
And
some
I just want to point out
solutions
to
here.
folks, Dr. McCullough has troponin here that's often used to diagnose infarction or a heart attack, myocardial infarction through a series of these tests to see if they go up. And then he also has here one of the more important markers of heart failure, which is this particular peptide, which can be measured as, an indication of heart failure. Anything else you wanted to add to
Oh,
that,
yeah.
Peter?
And you didn't circle the last one, galectin-3.
Oh, yes, yes.
That's a marker of cardiac fibrosis. By the way, in each and every patient who's had serious vaccine injury, I measure
Right.
troponin, BNP, and galectin-3. They're offered by LabCorp. They're very affordable. And
And
I
what
think
about
that's,
D-dimer? That's what I've been using as
yes,
well.
I measure D-dimer, but D-dimer is a measure of this micro blood clotting.
Right, exactly.
So I actually have it on a single ticket where I order these 3 in D-dimer. Yeah.
Oh, great.
Okay.
That's a great
If you
tip.
can zoom out, Michael,
Yep,
this is
happy to.
so you can see how useful this guide is going to be, and
It's a
make sure
great guide. When did this come out?
this came out in the last few months.
Oh, wow. Okay.
And we worked so hard on it
It's
to
amazing.
show, and then
Incredible.
we've described the body systems that are affected, and just scroll down.
Yep.
I want to get to, importantly, the antibody measures and the
Yeah.
measure. Keep going. Scroll down.
Yep. Oh,
Okay, here we go. So at the lower left is the use of the LabCorp quantitative antibody against the spike protein. This is done on what's called the Roche Alexis system, and this is the premier test. It's a LabCorp. You can self-order it. So if you go to labcorp.com, Labs on Demand,
yep.
infectious diseases, COVID-19 antibody, and just click on it. It'll do this test for you. You pay $69
Wow.
and just order it yourself. You don't need a doctor.
Hmm.
This is so important because a lot of
Wow.
doctors don't want to go there with this
Right.
problem.
Right.
And so this is telling people, and this is based on hundreds of publications, our review of this, and what I found in my practice. If it's less than 1,000 units per ml, it's very low risk past exposure.
Okay.
If you're in this category, you're honestly free and clear. Most people with the infection, they've had it once or twice, they're below this level. That's where my wife is, my co-author, John Leake.
Yes.
And some very fortunate vaccinated patients. So my mother-in-law took two Pfizer shots. She's 92. She lives with us. This is back in 2021.
Right.
And she never even felt a sore arm. Nothing.
Wow. Wow.
Nothing at all. And she measured
amazing.
at 200 units per ml.
Oh.
200.
Now,
Now,
Peter, we're going to get into your base spike detoxification protocol. Have you seen these numbers drop?
Yes. And we've
Wow.
published that. They
That's
drop.
huge.
So you want to see about a 20% drop in the antibodies. Remember, the antibodies lag the spike antigen by 6 to 9 months. So all you want to do is see the antibodies moving the right direction.
Right.
That means there's less spike stimulating those B
Right.
cells and plasma cells, and the antibodies go down. But there's a paper by Barham and colleagues showing that the average person who's having long COVID syndrome is at 2,000, and the average patient with a vaccine syndrome is at 11,000.
Oh.
Okay.
Wow.
So
Wow.
today I had a man with multiple blood clots, relentless, and he's been unmeasurably high, over 25,000 now for a year and a half.
Wow.
So, and LabCorp tells us they can measure it up to 100,000, 70,000. They just have to truncate it because it takes time to keep doing
Right.
the dilutions and then,
Wow.
converting it to a quantitative number. So they have to call it at 25,000. Don't try to order at Quest. Quest truncates it at like 2,500, and they're using something called the COBIS system, or don't send it to CPL. It's got to be LabCorp and the Roche Alexis system. And it's only $69. Thank goodness. You can just order it yourself. Many
That's
of you
fabulous.
are healthcare providers. You've
Yes.
been exposed to patients. I'll tell you my story. I was treating patients all through the pandemic. I had one documented case of COVID documented, and
Right.
then I had 2 contextual cases. And I was at 2,300 myself.
Oh.
And my ears are ringing. I had tinnitus. I didn't feel so
Oh.
well. And I
Wow.
went on the spike detox, and it took about 9 months, and I dropped it to 900. And
Wow. Now, is
my
that the
ear,
retest interval, Peter? 6 to 9 months to
yeah,
repeat the blood test?
it's actually probably 9 to 12 months.
9 to 12 months to repeat the
Yeah,
blood
you
test.
just you can't measure it every 3 months. I've had
Right, right,
patients do
right.
that. They get so frustrated. Okay, if we can get
Okay.
back to the guide.
Yeah, you bet.
So the antibody measurement's important because it does indicate exposure. Now, let me tell you, this is how important it is. If somebody has a serious problem like a blood clot
Right,
and their number is 200 or 300,
right.
I can tell you the blood clot is not due to the spike protein. It's probably due to a genetic factor or other factors. It's
Okay.
very important. Under 1,000 has a very strong negative predictive value based on all the peer-reviewed studies.
Okay.
Yeah.
So meaning if they have a low risk, they have a low number below 1,000 and blood clots, it's not due to these spike.
Yeah. I mean, but that's how useful it is. Yeah. Go ahead and scroll down.
Sure.
Okay. Now, here is the natural detoxification proposed. And we proposed this in 2023 after we had already worked with this through 2022. So this is, it's going on 4 years now. Nattokinase, which is a natural proteolytic thrombolytic enzyme derived from the fermentation of soy or chickpeas. Bromelain, which is a family of enzymes. And by the way, it's also a prescription drug used topically. Bromelain is a family of proteolytic enzymes that is actually a natural anticoagulant derived from pineapple and the stems of pineapple. But bromelain actually prolongs the prothrombin time. So it is an anticoagulant. And then curcumin, derived from turmeric, and curcumin is a natural anti-inflammatory. And in meta-analysis, curcumin in human randomized trials reduced the risk of severe COVID. So it had anti-SARS-CoV-2 properties. And so these were combined into a single product. The wellness company has the Ultimate Spike Detox.
Right.
And probably our greatest move on this was to massively increase the doses. So at 2 capsules twice a day, one is getting 8,000 fibrinolytic units of nattokinase. They're getting 500 milligrams of bromelain and 1,000 milligrams of curcumin. I commonly even double that to get it to even higher doses.
Yep.
And the single greatest caveat is taking prescription blood thinners like Eliquis, like Xarelto, Pradaxa, or even warfarin. Now, you do that in my practice, but with a caveat that if there's bleeding, nosebleeds, bleeding while brushing teeth, or bleeding under the skin, we have to back off on the dose. We should stop these products before major dental work or surgery for at least 2 days.
2 days. Yeah.
Yeah.
So, Peter, is it also you checking PT and INR as well at this if you're taking an anticoagulant?
No, with the novel anticoagulants, those tests aren't reliable. Of course, in warfarin, we measure the INR, the international normalized ratio. But no additional blood testing is needed. It's really kind of a clinical caveat we just warn patients about. Now, I've treated several thousand patients with this protocol. At this point in time, I've had one serious case of bleeding. One? And it was in a patient with occult liver disease, and he already had a prolonged prothrombin time due to liver disease.
Okay.
And so he came in with esophageal bleeding. We stopped the products, and he didn't need a transfusion, or it wasn't fatal. But I've had one serious case. So I think the reason why we're doing so well is we warn people about this. We're using natural products at medicinal levels.
Yeah, and Peter, I just want to underline something you said before, that there are no pharmaceuticals and no body proteins, or proteases rather, that will address the spike.
Right. So if you did something like, people have said, well, just boost the immune system. So the medical doctors have said, well, give Miraviroc, which is an HIV drug, or you would say give elderberry, or give something else. It boosting the immune system doesn't solve the problem, because we need the exogenous enzymes.
Yes. Yeah. And this is empty stomach?
Empty stomach.
Yep.
And with nattokinase, we actually even have pharmacodynamic data where it's actually been measured in the bloodstream. So for sure, natto gets in the bloodstream. Bromolin's partially absorbed. At best, maybe 40% gets in the bloodstream.
Yep.
Curcumin, notoriously difficult to get into the
Yes.
bloodstream. So it's
That's
either
right.
provided in liposomal format or micronized or with biopurine or some other fenugreek or some other absorptive. Now, I have to say, people said, well, if these enzymes work, do others work? We think that sureptase probably would work, but there are no preclinical or clinical data. None.
And
None.
lumbar kinase is the other one.
Lumbar kinase, I think it's going to be unlikely, but no data whatsoever. None.
Okay.
Not even a single in vitro study. At least with nattokinase and bromelain, you can physically see the spike protein dissolve in the preclinical studies. It literally dissolves.
Wow.
And nattokinase goes inside cells and outside cells and doesn't hurt the cell, viability at all.
Right.
So we think nattokinase is the big horse.
Okay. And then, you have thousands of patients who have used this protocol successfully.
Mm-hmm. Now, let me say, I've had a handful of patients that we just can't seem to get this down, a handful. And we've gone on to advanced therapies. And one of the things we've done, particularly, I had a patient with blood clots, turbo cancer, it was just horrible. And so we partnered with a company called Neo7 Bioscience, led by John Cantazzaro. And his company actually makes targeted peptides that are targeted to kind of bind with the spike protein and then allow that complex to be cleared. And so it's experimental, and patients sign up for this and sign consent, what have you. So, that's a next level that we have.
So I have got a plan B for people who need it.
Right. I've had people try plasma exchange. It doesn't work because most of the spike is way out in the skin and the tissue, so you can't pull it off with dialysis. Okay. I've had patients try ozone. That doesn't work because even if you could ozonate it in some way, it doesn't really seem to do anything. And I've had patients come back with brachial or superficial blood clots because the spike protein is so thrombogenic. Once you remove blood from the body and try to put it back in the body, watch out. Same thing with stem cells. I've had patients with stem cells either cause blood clots in the arms or even cause heart failure, one patient. And it depends on the source of the stem cells, but the stem cells are probably, contaminated with spike protein. IVIG almost certainly is contaminated with spike protein.
Really?
So, yeah. It's a combined product from thousands of donors. So wouldn't advise those. There's so many things that people have tried. So I have patients that come to me and say, Dr. McCullough, I tried stem cells, plasma exchange, IVIG. I've tried ozone. I've tried, they keep going on and on. I said, well, have you done anything to get rid of the spike protein, like spike detox? No, I haven't done that yet. It's like, that's the cause of the problem. I mean, this is, fortunately, nattokinase, bromelain, curcumin are affordable supplements. If you want to buy them separately and try to do your own, if you want to buy the combined product from the wellness company. The wellness company, we specifically did not patent this. It's very important. No patents, because there's too many people that need this. Yes. And there should be no restriction in the supply chain here.
Yes.
So it's copyrighted in my name, for the idea, responsibility. I'm responsible for the idea. And that was in 2023.
Wow.
But this is important. And naturopathic doctors can work and tweak this. And I'm sure some would say, add other enzymes. Now, there is one report by Dr. Shirasawa in Japan. Now, this is a man about my age in his 60s who took the shots, 4 shots, and he had bilateral blood clots in his carotids that were throttling. They were actually just throttling there, and he thought little microclots were causing cognitive decline. And Shirasawa, so alarmed with this kind of impending, stroke syndrome, he applied a dozen things at once, including nattokinase, bromelain, curcumin, papain, sureptase, lumbrokinase, and the list goes on and on. He blasted them with a high-dose enzymatic blend.
Right.
And he demonstrated on serial virtual angioscopies that he cleared the blood clots. There was a spike in D-dimer, then it went down, and the patient resolved his symptoms.
Oh, wow.
Yeah. So,
Wow.
the idea is dissolve the spike protein,
Oh,
dissolve it or sweat it out of the body. Now,
right.
let me say parenthetically, besides sauna and sweating, the other non-pharmaceutical, non-supplement intervention that seems to work in almost every case, at least making people feel better, is
Right.
hyperbaric oxygen.
Oh, okay.
Yeah. So I routinely recommend that at least 20 sessions at 100% oxygen at 2 to 3 atmospheres if you can go for
2 to
90
3.
minutes.
Wow.
Yeah, really crank it up. And at that point, that hyperoxygenation may change the conformation of the spike protein and the body may be able to clear it, although there's no
Interesting.
evidence to support that. It's just that every study is positive. It's hard not to
Right.
recommend it.
Right.
There is another supplement of which there are emerging data, and that's N-acetylcysteine. And at the Wellness Company, we have an Ultra NAC, which is NAC with some other detoxifant like milk thistle and other products you recommend. There's a company in Europe that has augmented NAC that says that it's actually changed the nuclear magnetic resonance of N-acetylcysteine. That's still yet to be demonstrated. They claim they have seen clearance of spike fragments in the urine, but with no published data for us to analyze. But there's enough there, and I've seen enough people get better that I think adding N-acetylcysteine for sure to the spike detox. So the spike detox is nattokinase, bromelain, curcumin.
Right.
That'll be Wellness Company, Ultimate Spike Detox, and then N-acetylcysteine. The enzymes, make sure you take on an empty stomach.
Right.
The other products doesn't matter so much, at least a year or more. And then other products can be added. If there's myocarditis, I prescribe colchicine. That's another natural product, but it's a prescription. Autoimmune, I prescribe hydroxychloroquine. If I think the SARS-CoV-2 infection is still in the body with infective symptoms, night sweats, skin rashes, pulmonary findings, then I'll prescribe ivermectin. Prescribe it for about 90 days.
Okay. Okay. And I want to let folks know the Wellness Company has generously given our listeners a discount on their products. So you'll see a link in the chat on our watch page and in our Zoom link where you can get a discount on Dr. McCullough's products, both the Spike Detox and the NAC. And
that's what Spike Detox is in the gold label.
Oh, there it is. Okay.
Yeah, it looks like that. And then the NAC is silver label.
Okay.
So those we think there's enough there. Now, when I publish this in copyright, I use the word base spike detoxification. That means it's a base. You want to add other things to it.
Oh, okay. I was wondering.
Let me say one thing, Michael.
That's foundational.
I've learned with the infection and now with long COVID and the vaccine, single remedies just don't work. This spike protein and virus is too complex. People said, well, just take some silver and you'll be better. It's like, single things don't work. We have to use multiple different products in combination. Fortunately, most of the products are natural.
Yeah, and it sounds like it's necessary because the main thing is to clear the spike. There are no endogenous proteases that do the job. On the pharmaceutical side, the prescription proteases are not getting the job done.
That's right. And people have even tried to revive the monoclonal antibodies, the anti-spike monoclonal antibodies, and there were 6 of them. A meritorious try. But the spike protein is deep into tissues now. And these enzymes do slowly percolate into tissues. And there probably is a body, biodistribution and redistribution of the spike protein. But you can imagine it's going to take a long time.
Right. And I want to pick up on something you said earlier, Peter. This is a short video. Let me make sure. You mentioned the importance of circulation. I just want to show a short Beamer video before and after that might be helpful. Oops.
Where you go. Yeah, so these syndromes is the...
Hold on.
But Michael, you almost pulled it off.
I did. I just, I clicked the wrong button.
But these syndromes are the perfect application for the Beamer, as an example.
Yes.
any of these products that can improve the microcirculation, the nice
Right.
thing about it is you can only take so many supplements, and
Right.
patients want to know what else they can do. So see if you
Right.
can bring this up. But
Yep.
I
I've got it
anticipate
here.
it's going to really show. Yeah, there you go. There
And
you
this
go.
is
Yeah.
before and after. This is, and just to give some context, this is a healthy 37-year-old male, no health issues, no health problems, athletic, fit. It was just stress
Mm,
impairing microvascular circulation. And you
wow.
see on the left, that is an arteriole with a
Hmm.
branching capillary and very stagnant blood. And then you see after 8 minutes, that's it, 8 minutes, the blood is just flying through that arteriole and that
Hmm.
capillary just opened right up. So I appreciate what you said about the importance of whatever we
Hmm.
can do to improve circulation. I think this would be an ideal adjunct to help the body with, as an adjunct to these other measures to detoxify.
For sure. For
So,
sure. So hopefully these principles we went over are helpful. This is a great vista. We've had 1 year of the new Trump RFK administration. They've made zero investment in researching the spike protein,
mm,
zero investment in randomized trials. I
wow,
don't think we're going to see it, to be honest with you. I think it's going to
really?
be left up to us empirically treating patients and doing the best we can publishing.
Wow, wow. Amazing. Well, great, Peter. So, how can folks get a hold of you? Just petermcculloughmd.com,
All
wellness
right, so for
company.
appointments, petermcculloughmd.com,
Yep,
wellness company, twc.health, and you should have a promo code. Hopefully, Michael, you've got it.
I
Is
do.
it
Gaeta,
okay?
Gaeta.
Okay, so twc.health/GAETA. Great Italian promo code. And make sure you support McCullough Foundation, mcculloughfnd.org. That supports all of our research, and myself, Nick Hulsher, John Leake. We're commonly testifying. Nick and John will be on Capitol Hill in a few weeks testifying. We're representing you in fighting for medical freedom and to just get past these terrible pandemic years and
Yep,
get us back on track. And make sure sign up for Focal Points. It's free. www.thefocalpoints.com. Get
yeah,
your newsletter every day between 4 and 5 a.m. And then finally, America Out Loud Talk Radio, McCullough Report.
yeah, that's excellent. Peter McCullough, you are a treasure. Thank you so much. I just appreciate all that you went through from, being the attacks from what I call the medical mafia, just trying to silence you for just advocating for science, advocating for early treatment, questioning the safety of these experimental injections. I just, we appreciate you very much.
Thank you.
Yeah, thank you, Peter. I know you've got patients to get to. So thank you for your time today. And we're going to carry on. I want to review some of what Peter covered with us and also give you access to the guide that he spoke about. So, okay, he has signed off. Let me just confirm that. Okay, yep. Yeah, just really, wow, that was remarkable. So just so appreciative of Peter taking the time out of his clinic. This is patient day for him, and that's why his first appearance on the show was recorded. We did a recorded interview for his first appearance on the show, just because today's patient day, and I'm sure he's walking into the treatment room any minute to do that. So sorry he wasn't able to answer questions. A lot of our guests have extra time where they can do that, but I just appreciate Peter's hour with us. And I will do my best to answer questions. I'm not Peter McCullough, but I will give a go on